Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to do some exercises for knee pain relief. Now we're going to do a couple of different stretches. We're going to stretch the inside, we're going to stretch the front, and we're going to stretch the back of the leg. Very often, knee pain is not caused by anything going wrong in the knee. It's actually caused by muscles that are malfunctioning outside of the knee. Your hip, your ankle, your lower leg, your hamstring, your quad. These all have effect on your knee. So while we're going to show you some exercises that stretch other parts of your leg and don't necessarily relate to the knee, most often these are the causes of knee pain, whether it be weakness, whether it be tightness, whether it be a strain, a sprain, whatever. This is generally this is generally why people have knee pain, is because of malfunctions that are going on above and below that knee joint. You're going to find that we're not going to stretch the outside of the leg, which is the IT band. This is a huge culprit in knee pain. However, there is a stretch that is on the internet showing where you cross your foot over, push your hip against the wall, and that's how you stretch the IT band. That's a big fallacy. You cannot stretch the IT band. Research has shown that it is a fibrous, tissue that cannot be stretched. If you want to make a change to the IT band, you're going to have to do foam rolling. We're not going to foam roll in this video. We do other videos that can show you how to foam roll the IT band, but I just wanted to explain why you're going to see us stretch the front, the inside, and the back, but we're going to leave the outside alone. The outside, the IT band, is a very big cause of knee pain, but stretching is not going to benefit. So you want to find a raised surface, a curve, a step. The first stretch you're going to do is the gastroc stretch. So you're going to step up, place the balls of your feet on the step, and you're just going to drop your heel down. You want to keep your knee straight. You're going to feel a stretch all through the back of your leg, possibly down into the heel, possibly up into the hamstring. If you feel numbness or tingling or pain, you want to stop immediately. You want to hold this 30 seconds, and you want to do about 6 sets of these. You want to do it one leg at a time, and then switch to the other leg. The next stretch you're going to do is a hamstring stretch. You want to be very, very careful on how you do your hamstring stretch. A hamstring stretch is often not done correctly because you wind up bending at the back, and you wind up flexing at the lower back and at the upper back. This is not going to stretch your hamstring. So you want to make sure that you hinge at the hips. So you want to stand up straight and hinge right at the hips. You want to have your toes up towards your nose, so the heel is right on the curve or the step. You want to make sure that your back is nice and straight. Again, if you have pain or numbness or tingling, you want to stop this exercise and call your doctor. The next one we're going to do is the adductor stretch, which is going to stretch the inside of your leg. You can do this one on the floor as well, but you get a more effective stretch if you put your leg up on a stool or a stair. You're going to have your toes pointing forward, your foot flat, and you're going to bend that opposite knee. You may get a stretch just by putting your leg up on the step. If that's the case, stop there. Do not bend that other knee. You want to go down as far forward as you can until you feel a nice stretch, and then you can come up, repeat that 6 times. You're going to do 30-second holds of those also. Then you can switch to the other side. The final stretch that we're going to show you is a quad stretch. So you might need something to hold on to in order to do this, but you just want to reach back and grab the ankle of the leg, the hand that's reaching back. You're going to feel a stretch on the front, maybe even into the hip flexor, into the quad. Again, if you have pain, you want to stop, but you should hold this 30 seconds, 6 times. If you have any questions, please give us a call at 215-997-9898, or visit us on the web at www.totalperformancept.com.